good morning, good afternoon, good evening, depending on where you're listening from. My name is Ebunlo Ayimode. I'm the rapporteur of the Health Diplomacy Youth Network, and I'm delighted to welcome you to this episode of the Health Diplomacy Youth Speaks. Today, we are diving into a topic that is both timely and critical, and we are joined by a truly exceptional speaker. When we talk about global health, it is easy to focus on the global, but in reality, some of the most meaningful progress happens at the regional level. And so that is why today's topic is on regional cooperation towards a healthier future, the role of health diplomacy. We are honored to be joined by a high-level leader whose work truly embodies the theme. Dr. Ntuli Kapologwe, my apologies, is the Director General of the East, Central, and South African Community. Dr. Ntuli, it's a pleasure to have you with us, and welcome to Health Diplomacy Youth Speaks.
Thank you very much.
Yes, sir. And first, let me start by saying a huge congratulations on the signing of a landmark MOU with the World Health Organization African region, to strengthen health cooperation across. It's a huge one. Congratulations, sir.
Thank you very much. Thank you very much. We appreciate a lot for that. That's indeed a huge milestone, because these two organizations are quite strategic organizations. We need to work together so that we can synergize our efforts in improving the health outcome and the well-being of the continent Africa.
Yes, and so while we'll dive right to it, can we have just a brief introduction, just to get to know you? Yes, sir.
Thank you very much. So my name's Ntuli Kapologwe. I'm the Director General of East Central and Southern Africa Health Community, Health Community, which is an intergovernmental and diplomatic organization. It has 9 member states. However, our work spans in up to 30 African countries.
Wow, that's huge. That's huge. And so we discussed, let me start with this. What are the most pressing public health challenges, facing ECSA, today? Which of these challenges, demands major regional cooperation?
Indeed, we have, like any other region in the continent Africa, the ECSA health community, it is facing the dual burden of diseases, persistent communicable diseases such as HIV, malaria, and tuberculosis, and the recurrent outbreaks from cholera to Marburg to Mpox, just to name few. But alongside with these communicable diseases, we also have the sharp rise of non-communicable diseases such as hypertension, diabetes, but without forgetting mental health challenges and injuries. And apart from that, I must say that these dual burden of diseases are compounded by other challenges, which include the climate change, the food insecurity, and issues to do with the fragile healthcare system. But without forgetting now that we are not an island, what is happening around the globe also affects our region. From the geopolitical shifts, as you were aware that last year, the world experienced the reduced development assistance. We also had the global economic uncertainties and also supply chain disruption. So these are some of the global challenges which also affects the ECSA region.
Yeah, thank you, sir. To pick on what, moving forward, what you just made mention, and you said, addressing this, we are not an island, cooperation is very, very important. We actually regard the topic in which we are addressing. And what I want to ask now is, why is regional cooperation more effective than country-by-country approaches in addressing these challenges?
The reason why a regional cooperation is essential is because diseases respects no borders. So as our solutions need to transcend across our borders. So with regional cooperation offers opportunity for cross-border coordination, they offers opportunity for negotiations. So all these needs really to have the regional coordination. But now looking into the health diplomacy, issues to do with the negotiation, issues to do with the technical cooperation, policy dialogue, and advocacy cannot be left out. That's why for Africa to be able to achieve a high health outcomes and well-being, we also need to embrace the health diplomacy at every conversation that we are having at the moment going forward.
Thank you very much. Still back to the regional cooperation. Have we achieved, can you give like a percentage of what has been achieved in the past? I know we are still building on it because I want viewers to really understand the gap that is existed now and where we stand. So can you speak more about that regional cooperation?
Yes. So now, Access Community, together with other regional organizations, we are championing what we call the South-South Cooperation, which is part of the regional cooperation and partnership. And the reason why we are championing for that is because Africa do import more than 90% of health commodities. Also, we are faced with some other challenges, including increasing antimicrobial resistance. But apart from that, we are also facing challenges from the cross-border diseases. Now, through regional cooperation, we have been able to use some of the approaches which seem to be working very well. One is the pooled procurement, just to strengthen the supply chain for health commodities and vaccines in the region. Two, in trying to advocate for sustainable domestic financing, which we also push for the agenda for the blended financing and innovative financing, which is well spread in the Abuja Declaration as well as the Lusaka Agenda, which requires the continent Africa to be able to self-sustain in their financing and also in the provision of services. But we are also implementing the initiative which is under the Africa Sovereignty Agenda, which, among other things, is advocating for local manufacturing capacities so that to address the challenge of huge imports, but also self-sustenance or domestic financing without forgetting the digital health technology. So these are some of the things which the East Central Southern Africa Health Community is pushing as part of the health diplomacy in making sure that we as the region, we can self-sustain in some of the very important elements of the healthcare system. But in whatever we are doing, we are making sure that the youth, who constitute about 65% of our population, are at the center of the conversation. So that whenever we are doing, we make sure that they are very much engaged so that they can own all the initiatives that we are starting as a region.
I'm happy you made mention of the youth because I'm coming to that actually. But right now we can't talk about regional cooperation without making mention of partnership. And as the Director General, I want to ask a question. How does EXA actually, based on your leadership, how do you strengthen partnerships within institutions and global actors while promoting innovation at this regional level?
That's a very good question. So we as EXA, we want to pronounce ourselves as the Innovation and Research Hub, a regional innovation and research hub. But in so doing, what we have been always trying to do is to forge partnership and collaboration with different organizations, including regional bodies and sub-regional bodies. Last year, we were able to enter memorandum of understanding with a number of organizations, including WAHO, which is the West African Health Organization, operates under the ECOWAS. We did sign MOU with them because, as I said, diseases respect no borders. We need partnership from the West Africa as well as the East, Central, and Southern Africa. We did sign an MOU with the WHO Afro, as you saw on 16th of December last year. And in February, we shall also be signing MOU with Africa CDC. Why are we doing all of this? We do not want to duplicate efforts within the continent Africa. We know that WHO do formulate policies, so as Africa CDC. They also support with the resources. So we want to leverage on the partnership and to avoid duplication. But WHO and Africa CDC and the WOW, they also have the youth wing or the youth council. So next month, we will be having between 30th of this month to 2nd of February 2026, we shall be having the Regional Youth Summit on Sexual and Reproductive Health and the Demographic Dividend. So we have invited the WHO, Afro, Africa CDC, WAHO, even the youth representative from these regional and sub-regional levels to attend. We believe in so doing, we shall be strengthening the solidarity among our regional and sub-regional organizations.
Wow, that's great. And I want a point in which I'm taking from there is the importance of not duplicating effort, which I know we've seen in the past, which is a great strategy, you know, to work on. And I would say, well done, sir. That is novel and that is great. And right now, I want to ask, I know that the 76th ESCA Ministers Conference is coming up in February, and I just want to ask questions in regards to that as we move forward. What are the meaningful outcomes we should be expecting from this meeting?
So this meeting, it brings together all the ministers from our member states, but also from non-member states. So we shall be having a total of 17 ministers of health from 17 countries, but we have also invited development partners, representatives from regional and sub-regional levels, including Africa CDC, WHO, Afro, and partners like the Health Diplomacy Alliance. They'll be part of that gathering. But that meeting would be presided by the youth Regional Youth Sexual and Reproductive Health and Demographic Dividend Summit, which will give opportunity for the youth to discuss various issues from mental health to health security to antimicrobial resistance to neglected tropical diseases, sustainable financing, as well as the whole idea of health sovereignty. So we want to empower youth in the continent to be able to speak and also to be part of the solution of the challenges that the EXA health community and other regions are experiencing. But what is going to be actually agreed in the youth summit is going to be a declaration which is going to be carried forward now to the 76th Health Ministers Conference. They will discuss about it, and the resolution will come out of that declaration that is going to be put forward by the youth. So this is how we are going to be actually conducting our conference. And this is one of the very important conferences, given the challenges that the world and the Africa region has experienced in the previous year, from the shifting in the financing landscape, geopolitical tensions, to the challenges in our healthcare system. So there are a number of themes that will be discussed, and in the end, the ministers, they'll give the directions, and there'll be resolutions that will come out of these conferences for us, together with the member states, to implement them.
Yeah, I'm glad that from what I can get from this discussion, that the channel is that youths are not just participants, but they are partners. And so they're working, they're working hand in hand with regards to this. And it's really great, because that's one of the things youth networks have been pushing forward to. We just don't want to be participants. We want to be partners in these conversations, to bring our ideas to the table, and so we can work together, to achieve that one goal, what we are looking at. And so that is great and awesome. Thank you so much. And now I want to, moving forward, I would want to ask, I know that as a regional body, I want us to go really into health diplomacy, and to discuss regards to that, how EXA really, effectively, work with global actors to mobilize sustainable finances, foreign affairs influencing decisions regards to this. How do you juggle that diplomacy aspect? I guess that's my question, because, the youth network is about health diplomacy. And so we just want to learn from you. How do you juggle that?
Thank you very much. That's a very good question. Understanding that health diplomacy is an intersection between public health, it's also an intersection public health for policy and development. So we have had a number of initiatives to making sure that we pronounce ourselves as a regional body that is frontiering the health diplomacy in Africa. So one among other or many things has been now to establish partnership with the Health Diplomacy Alliance. And luckily, we shall be having the sideline or side event, a meeting on the sideline of the World Health Assembly in May this year, where we will work jointly with health diplomacy to discuss issues around health diplomacy, particularly on antimicrobial resistance. Secondly, we have also established with some other organizations or learning institutions which are also pushing for health diplomacy agenda, including the University of Memphis School of Public Health. Also, we have some other organizations in the US, like the Best Diplomats, so that to consolidate these efforts and avoid fragmentation. And we are now seeing that with these partnerships that we have established, we can clearly see tangible results coming out of this partnership. Even last month, we were able to host the regional health diplomacy workshop in Lusaka, Zambia, which was attended by the permanent or principal secretaries of Ministers of Health and other senior government officials from Ministers of Health from 10 countries. And what we were able to learn from the participants, they said, we need to scale this one down through the cascade approach so that this shouldn't just hang at the policy level, but it should go up to the pre-implementation level. So this is what we've been able to achieve. And we are also welcoming some other partners in this space so that the agenda of health diplomacy can be well known, especially in Africa, which to somehow we are a little bit lagging behind in terms of the diplomacy around the health sector.
Thank you so much, sir. And as we close, my final question to you is, I just want you to share with us one goal or one vision that ESCA has this year and how people can key into it.
Our goal for this year is to make sure that the health diplomacy is actually taken to all member states. But in whatever we are doing, we must make sure that youth are at the center of all the initiatives. We have the well-established youth wing at EXA. So happy to work with Health Diplomacy Alliance through the youth platform to make sure that health diplomacy is well understood by youth and adults so that Africa can benefit from its people who are conversant with the health diplomacy concepts. Thank you.
Thank you so much, sir. And so you've heard, and it's very important for us all to key into this vision for the year 2026. We are grateful, Dr. Ntuli, for joining us today. And I'm sure definitely there'll be more of this moving forward.
Thank you very much.
Thank you so much.
Thank you.